Good day, class. Welcome back to NURS 345. In the previous session, we talked about ways of knowing. Today, we are going to try to define nursing research and what is involved in nursing research. So before we even define nursing research, I want us to define research as in general. So generally, research is a systematic inquiry into a problem of interest to you or something that you have a passion for. In the previous section, I think we talked about why it is systematic. It's systematic because you have to go through certain steps. And so today, I'm expecting that by the end of the class, each of you will be able to define nursing research and research itself, explain the goals of nursing research, discuss the importance of nursing research, and then describe the types of research available. As I said, we have 4 or 5 areas to cover in this session. So let's start with the first one, but before then, you can get today's session from chapter 1 of the Foundation of Nursing Research, which is part of your reading list. So now let's define research and then nursing research as well. What is research? Somehow we have already defined the word research, but I just want to emphasize that when you hear the term research, it means that you want to go around something, you want to explore something, you want to have more meaning to something that you have in mind. It means you are willing to go through some circles to acquire some knowledge. And so, as we said previously, research is a systematic inquiry into a problem that you have interest for. It involves making so many decisions, and that is why it is in the form of a circle. You make back and forth decisions. Now, nursing research, having looked at nursing research, what do you think is nursing research? Why is it important for nurses to know something about research, or nurses, why is it important for nurses to do research? We will go through all of that. So, nursing research is also a systematic inquiry into a problem that is important to nursing. A systematic inquiry into a problem that is important to nursing. Now, that problem is important to nursing, but you as the researcher, you must have an interest or passion for the topic that you are interested in. And so nursing research refers to a systematic inquiry, as I said before. It has to have some importance to the profession. Otherwise, we don't call it nursing research. You cannot do research that cannot, put together some knowledge for nursing. So what are these areas that are of interest to nursing, or that are of important concern to nurses? Now, this picture shows that there are 3 interlocking circles. Now, there are so many areas that nurses are interested in terms of research. Understanding the human experience is one of the areas. So, for instance, people have problems with them that they want to talk about, but they have no avenue to talk about them. Through research, they would be able to talk about them and people will hear their voices. It's nurses who will be able to put together this way of understanding whatever problem they have. Then the yellow circle, improving healthcare and health systems. You all agree that we have so many problems in our healthcare system, and so the areas that are of importance to nursing can be researched into by nurses. Then we have the next circle, which is promoting human health. Nurses try to promote human health, and so we need to do research in the area to come up with, solutions that we can use to solve problems that can promote human health. Now, the interlocking of the circle, the middle part of the 3 circles is where nursing research is, which tells you that there are so many areas that nurses can do research. Now, as I said, the middle part of it indicates that nursing research contributes to the science of the individual, the family, and the community, which also means that nurses do research about individuals, which is their lived experiences. They do research about families, trying to understand problems in the family, and then community health. Good, so why must nurses do research? Let's talk about why nurses must do research. It is important that nurses are able to do research for the following reasons, so that they will be able to provide evidence for better clinical decision making. Gone are the days when you can just make a decision without having a scientific explanation of it. Today, we want to be able to say that research says that this is what is appropriate for patient care. And then two, to improve care through the understanding of human experience. It's only through research that we'll be able to do that. To promote evidence-based practice. As I said, you need to have evidence for all the decisions that you make, for everything that you do for the patient. You need to have some scientific evidence to back that. Then, last but not the least, we want to be able to build knowledge for the field of nursing. And this is why it's important that nurses must do research, so that we are able to say that we have our own body of knowledge. Now let's talk about the goals for conducting nursing research. What are these goals? They are not different from the reasons that we explained earlier. We want to be able to promote evidence-based nursing practice. Evidence-based nursing practice means that everything you do has a scientific reason. Ensure credibility of the nursing profession. Nursing has borrowed knowledge from different disciplines for so many years. It is about time that we have our own body of knowledge, and it is only through research we can do that. If we have that body of knowledge, then we would say that we are credible. We are credible now, but we still need more of that knowledge to increase our credibility. Provide accountability for nursing practice. Let me take you back through each of those. Now, if you look at this diagram, there's knowledge and experience at one end. At the other end, there's best available clinical evidence. You can tell that this bar is not balanced. We are trying to have a balance between knowledge and experience, and then best available clinical practice. Now, ensuring credibility. I mentioned earlier that we need to build our own body of knowledge, which is distinct from other disciplines, and you can only do that through scientific research. For us to also be able to demonstrate that we are credible, we need this unique knowledge, which will make a difference in the care that we provide to clients. Now, providing accountability, or provide accountability for nursing practice. Being able to make independent clinical decisions about your clients is very important. And it is even more acceptable when you have the scientific backing of that. So we want to be able to make some kind of rational actions or rational decisions, and you need the scientific knowledge to back that. Nurses must be abreast with current scientific knowledge. If we have to talk about accountability, you should be able to scientifically explain all your actions, even if you are caught on guard. Having the ability to critique research articles to identify findings that are appropriate for practice. There are so many research articles out there, but how many nurses are able to critique these articles to be able to use the findings or apply the findings in the care of nursing? That is probably because we don't know how to go about this. So in this class, we will talk about all of that. Cost effectiveness of nursing practice. Nursing care is a significant part of the care, all the medical care that is provided in our hospitals. But let's think back and try to see if there's any monetary value attached to the care that you provide to your patients. For instance, if you asked a medical officer how much it costs to do a cesarean section, I'm sure they'll be able to give you a monetary figure. But how much does it cost to feed an unconscious patient for 1 week? We don't know. That is because we don't seem to be accountable to our, care that we provide. And so, for us to be scientific, we want nurses to be able to have that scientific knowledge so that you can provide evidence-based practice. With that one, we can fight that they put a monetary value to all the care that nurses provide. How do you evaluate the evidence? There are so many articles out there about nursing issues. How do you know that Article A is better than Article B? Let's go through that. Now, the very first step is formulating your research clinical question, just as we went through the scientific problem solving. You cannot be able to evaluate the evidence if you don't have a clinical question. So for instance, there were those so many years ago, patients were fed through a syringe. You push the liquid food through the tube in a syringe. Today we don't do that anymore. That is a simple question. And then you are trying to find out why we don't do that anymore. The next step for you to do is to search for evidence as to why we don't do that anymore. And then that means that you will go into the literature to read a little bit about tube feeding to gather the evidence. Now, appraising the evidence, you may come across some research findings that are talking about some of the reasons why we shifted away from syringe tube feeding to the gravitation that we do today. After you have done that, by all means, there may be some of the articles that really give you the good reasons why you don't do what we used to do. And that is what you apply as your evidence. And so if I come to your clinical area and then I see you, feeding by gravitation, and I ask you why you are doing that, why are you not using the syringe? You should be able to explain using some scientific articles. Good, so now let's talk about the importance of nursing research. We have talked about the goals. Let's see the importance of nursing research. Now, as we discussed earlier, nursing research is important for the following reasons. Research findings provide evidence for nurses' decision making and actions. We have said this before, and so I won't waste time on it. Any change in practice must be based on research findings. You cannot change your old way of doing things into a new way without any research findings. That's what we are talking about. Nursing research establishes scientific defensible reasons for nursing activities. Every activity that you do, we are saying that you need the scientific backing of everything you do as a nurse. Those are the important reasons why nurses do research. Now let's look at the types of research available. Basically, we have two main types: basic research and applied research. We will talk about each of them. Basic research, it just means that it's a new kind of knowledge you are trying to acquire, or it's a new knowledge that is not ready for implementation yet. And so the purpose of basic research is to test, either to test a theory or to develop new theories that may be useful in the future. So results from basic research usually are not applied immediately. They are applied later or in the future. Applied research. If somebody is doing applied research, that means that the person has identified a problem and the person is trying to find solutions to the problem. Now, when you have those solutions, you will apply them. And so you are doing the research so that you want to take action on a particular problem. There are other types of research based on the two key areas that we talked about. We have the quantitative research, qualitative, mixed method, emancipatory, and then action. We will briefly talk about each of them. Now let's look at quantitative. There are so many problems, as we talked about previously in nursing. There are some of the problems that you can explain using numbers. And so the best approach to go with those problems is quantitative research. And so quantitative research uses what we know as questionnaire or surveys to collect data. And then this data is analyzed and you have numbers that you should be able to explain or interpret to make meaning out of it. Qualitative research, we talked about the fact that some people have experiences that they want to talk about, but they don't know where to talk about them. So if you identify a problem that needs your participants to talk about them, the best approach to go is qualitative research. And so it is all about understanding human behavior and experience. And in qualitative research, we use data collection methods like observation, interview guides, which will be elaborated in subsequent lectures. In fact, qualitative research is not so much interested in generalization. That is, if you do a research in Accra, you can, for you to be able to say that because clients in probably Kolebu Teaching Hospital are experiencing a particular phenomenon, it must be the same for participants of Tamale Teaching Hospital. In qualitative research, it's very difficult to do that because the numbers are small. And so they have very small sample sizes, and then the focus of qualitative research is for you to come up with a thick descriptions of the experiences of participants. And that is what is more important rather than numbers as in quantitative research. And so let's look at the two, or let's look at the differences between the two of them, quantitative and qualitative. So in quantitative research, the data is structured in the sense that you have designed a questionnaire, and so you have a particular way of asking the questions, which means that the participants are somehow obliged to give you some particular answers. And if you compare that to qualitative, it's unstructured. Unstructured because the people are interviewed. You ask one question, the person can talk for 1 hour, giving you a lot of information. The next difference is the statistical way we analyze data in quantitative research. There is no way you can do that in qualitative research. Qualitative research is all about summaries of the experiences of your participants. Then objective conclusions. Because quantitative research has some numbers or percentages to support the results, we say that we can make some objective conclusions, which you cannot do in qualitative research because it is all subjective about the experiences of other people. Then the next difference is in the way we collect data. Surveys, questionnaire, experiments are used to collect data in quantitative research, whilst we use interviews, focus group discussions, and then observations for qualitative research. Now let's talk about mixed method research. Here it means that the problem is so big that you cannot use only the quantitative or qualitative, and so you want to put the two approaches together to be able to solve the problem. And so as you can see from this picture, you need a bigger lens. And needing a bigger lens means that putting the two approaches together. And so in mixed methods research, if we are putting the two approaches together, it means you can use questionnaire, you can do interviews, you can do observation, and all of that. Put all of them together. What matters in mixed method research is how you are able to integrate the different data that you have. You have qualitative data, you have quantitative data. How are you able to integrate that? And that is called data triangulation. Sometimes, because the problem is big, you may have a researcher who is more experienced in quantitative and another who is more experienced in qualitative, and you need to solve that problem. So the two of them need to come together. How are you able to put together or integrate the skills of these two investigators? Then the theoretical triangulation also matters. Because you are using two approaches, the quantitative approach may require you to use a certain theory, whilst the qualitative is asking for another. It is important that you are able to integrate the concepts of the two theories together. Then methodological triangulation. As we can see, the methods for qualitative are different from quantitative. So being able to integrate the two is also important. So what matters, the key area of mixed method research is triangulation. Now let's look at emancipatory research. Emancipatory research. Here it means that you have identified a group of people who are marginalized, a group of people who, you know, seem to be suffering, and you want to give them a voice. You want to give a voice to that kind of group of people. And so it also means that you want to advocate for a group of clients. And so the research you need to do is emancipatory research. In this type of research, it means that you are aiming at changing something. You cannot change that something if you don't involve the people you are studying. And so the key area here is that in this type of research, the participants are key areas of the research, or they must be part of the research. Otherwise, you will not have what you are studying. So it involves studying the lived experiences of this marginalized group, and at the end of it all, you are able to give them a voice. That voice is either published or submitted to a body somewhere, and somebody may come in to give them the help that they need. Action research. Action research. Here it also means that you have identified a problem which you need to solve immediately. You need solutions, immediate solutions to the problem. The way to go is action research. So action research is the approach used by practitioners like you. Nurses at the bedside are the ones who are supposed to be doing action research, because you have identified the problem, you will do the research, and you would apply your findings because you want to change something. And so that is the main purpose of action research. It is an approach commonly used to improve conditions and the practices of our clients in the hospitals. Now let's look at a few features of action research. Action research, you know, as I said, means that you want to implement the findings of your research, and so you need the collaboration of other stakeholders. And these stakeholders are your, you know, policymakers in the hospital, the patients or clients themselves are part of this collaboration, so that you will be able to come together to apply the findings. Its validity is strengthened through peer examination and discussion. You cannot do action research all alone. You need to discuss with your co-workers within the discipline and outside the discipline. That means that doctors may be part of it, nurses are part of it, pharmacists are part of it, all kinds of personnel are part of it, because you are all trying to solve the same problem. Then democratic in nature, that is what I just explained, because it requires that your participants are seen as part of the research or as equals. You don't call them research participants, they are part of the research. And so this kind of approach also contributes to the knowledge that we develop in nursing, and it is the very key way that we can go through to solve problems in our practice. Ethical considerations in research. Ethics, as we know, basically talks about what is wrong and what is right. So we will look at what is wrong and what is right in nursing research. Why are ethical guidelines important in research? We said earlier on that we are dealing with human participants, and these human participants have rights. We don't want to, you know, step on their rights, and we want to do scientific research. So that is the reason why it is important that we talk about these guidelines. So research ethics provide guidelines for the responsible conduct of research. Every researcher must be responsible for the actions that you take, making sure that you are not causing any harm. And then we also use the research ethics to be able to educate, you know, your participants, so that by the end, depending on the type of research, so that by the end of the research, they at least have some kind of knowledge. Research ethics also provide the rights of human participants, as we talked about, and then they ensure the moral way of doing things well. So there are three main principles that are important here for us to talk about. Beneficence, respect for human dignity, and justice. We will briefly talk about each of them. Beneficence simply means that you should not cause any harm to any participant of your research. They have the right to freedom from harm. They have the right from exploitation, and then they must also benefit from the research. Now let's talk about justice. Participants in the research have the right to fair and equitable treatment, which means that there should be no discrimination. If you have both men and women participating in your research, there should be no discrimination between the two. You can also have different categories of participants from different cultures. There should be no discrimination between the two. They should have the free will to participate and the free will to say, no, I don't want to do this. Even in the midst of the research, they should be free to say, no, I have withdrawn. I don't want to be part of this research anymore. They also have the right to privacy. Information given must be, you have to be able to code the information in such a way that people are not able to identify your participants. And that is why it is important that we don't collect what we call identifiable information like age, addresses, and the rest. If you all, have answered questionnaire before, no researcher asks for your name, and that is for the reason. So it has to be anonymous, or they have the right to anonymity. Then confidentiality. The information that they have given you, how are you keeping that information? How are you going to make sure that it is only the researcher who has access to that information? And so this is why ID is important. The information they give you must be recoded in such a way that only IDs are seen, no name. Nobody can be able to associate anything you have in the data with the participants. Do not enter identifiable information into the computer. As I said earlier, on identifiable information, you have the age, address, anything that you can use to identify your participant. You don't put it in the computer. That data should be locked up somewhere. Destroy all identifiable information. If by mistake you collect them, they should be destroyed as quickly as possible after you have done your analysis. And then all people involved in nursing research must sign a confidentiality agreement, especially if you are going to do some kind of invasive procedures. You need them to sign this agreement before you move on. Now let's talk about signing the agreement. Means that you need to have what we call informed consent. Informed consent. I know what is more common is consent form, but there's a reason why I turn this into informed consent. Informed consent in the sense that you need to give the participants the information. If they are aware of what you are doing, then they can append their signatures and then give you the right to collect information from them. That is why it's called informed consent. Now, giving participants the right information and adequate information about the research means that you should be able to explain the purpose of the research in the terms that the participants understand, not using professional or research jargons that will confuse them, because you want them to agree that I want to be part of this or I don't want to be part of this. You can have written informed consent where you have to read every word to the participants so that they will understand. We also have the oral informed consent where you can just read and explain to them, and so if they say I have agreed, then you can go on and do that kind of, but that is very, you only will be able to do oral informed consent in certain situations. So for instance, in the case of infertility or HIV, if you want people to sign before you collect information, they might not want to sign because you can even identify them by their signature, and so they will refuse to sign. And so somebody will tell you, yes, I have listened to you, I understand what you want to do, but I don't want to sign. That is, the person is requesting for oral informed consent, and that one is also accepted. The components of the informed consent are the following. This one talks about what the participant is supposed to do in the research. Are you interviewing the participant? Are you giving them questionnaire? Are you observing? What is the status of the participant? Then the purpose of the study, the type of data that you will be collecting, that is a survey or observation, focus group discussion, and all of that. Nature of commitment. Nature of commitment means that is this participant, are you having this interaction with the participant only at once, or you will go back to the participant at a particular time again for more data? All that needs to be explained. Is this study being sponsored by a particular institution? They need to know. Participant selection, they need to know how they are selected, how they got into the study. And then finally, data collection procedures involved. They need to know all of that. Then potential risks involved in the research. If there is any risk involved, you don't have to hide that from the participant. You need to explain to them. If you participate in this research, this is what may happen to you. However, I have solutions to help you out of the risk. Potential benefits. If something is coming out, if you are going to give them some money or a handkerchief, any token, you know, after they give you the data, you need to explain that to them. Confidentiality pledge. You have to let them trust that you will not share their information with anyone. Then voluntary consent. After you have explained everything to them, they should be able to say, okay, I will be part of this research, or I don't want to be part. And if they say they don't want to be part, you don't have to force them. The right to withdraw, even in the midst of, you know, answering your questionnaire, they can still withdraw, and it's accepted. Provide participants with researchers' contact information. It's important that your participants are in touch with you, so that if there's any problem, they can get in touch and let you know what is happening. So participants will only sign willingly if they understand the purpose of the study and then everything you have in the informed consent. How would you know that these participants understand? You can do that by asking questions for clarifications, demanding answers for the questions you ask, and then asking for more, you know, if participants ask you for more time or more explanation, that means that they really want to understand or they understand. Then they can go ahead and sign the informed consent for you. Now let's also talk about another area which is very important these days, institutional review boards. Almost all hospitals now in Ghana have institutional review boards, because even though researchers are aware of the human rights, you know, involved in research, these institutions want to make sure that researchers don't cause any harm to these participants. So institutional review boards are there to make sure that their participants or patients in the hospitals are safe. Now this is what they look for, you know, with any institutional review board. Are there any risks to participants? If yes, are the risks minimal? They have to be minimal because you don't want to cause any harm. Is the selection of the participants fair, or you are being biased or discriminating against some of them? Will the researcher seek information, you know, or seek for informed consent? If yes, will it be oral or will it be a written one? It's also important to the institutional review board. Are provisions made to ensure the safety of participants? And finally, privacy and confidentiality. So these are the areas that institutional review boards look for when they are reviewing proposals. So in summary, today we have talked about so many areas of research. We have defined research, we have defined nursing research. We have also talked about the ethical considerations that are necessary in research. So in our next session, we will talk about the steps in the research process, what we do to make sure that we have good findings that we can apply. So thank you, and then I'll see you in the next session.